As we were just saying, NVIDIA's earnings are now just one indication of how AI is being integrated into the workplace. Ambience Healthcare uses it to help clinicians with administrative tasks like summarizing patient records. One of its tools even listens to conversations with patients and turns them into structured notes. This type of technology is becoming prevalent enough to appear, get this, in HBO's medical drama, The Pit.
Dr. Alashimi.
Yes.
Dr. Santos was just using your AI tool for her charting, and it hallucinated a history of appendicitis.
As I mentioned to Dr. Santos, generative AI is not perfect. We still need to proofread every chart it creates.
Nikhil Buduma is the CEO of Ambience Healthcare. I'm not sure if your company has clarified the hallucinations yet. I know that it isn't something that happens all that often. That was fictional. This is real life, so I do want to get to what's going on in your company. AI, you say, uniquely poised to be the best solution because you're saying it fills this critical expertise gap between the entire healthcare spectrum. But I guess as patients, we all want to know, how will it benefit us and how quickly will we start to see that benefit?
That's such a great question, and thank you so much for having me. You think about the experience of a patient today, you probably remember the last time you went to the doctor's office, you traveled 30 minutes, you sit in a waiting room, you find yourself asking and answering the same questions over and over again. And when you're finally in that room with the doctor, oftentimes they're distracted. Their back is facing towards you. They're deep in their computer multitasking. And the reality is that's just the tip of the iceberg. The average doctor today is spending hours and hours and hours of their time searching through the electronic medical record, looking up guidelines, writing notes, navigating all the complexities of the insurance companies they work with. And the result is they don't get to spend the time and the attention they want with patients and their families. And so the opportunity that we're very excited about is how we use AI, add it as a member of every care team to alleviate that burden off of our caregivers so they can focus on what they do best, which is taking care of the patient and the family in front of them.
And what has been the feedback that you've gotten in clinics?
You know, I think for the average physician, they went into the practice of medicine to take care of people. And what's happened over the last decade of technology is that it's inserted itself in between the person and the patient and the family member on the other side. And so when you get to experience what it's like to look your patient in the eye and have a conversation with them and build a relationship with them, it brings back a joy and restores a sort of like fulfillment that is the reason why clinicians went into the practice of medicine in the first place. And for a lot of patients, it's the first time in their entire lives they actually feel really heard in that room. And so, you know, we're deployed across several of the major academic medical centers in the country, like Cleveland Clinic and Mayo Clinic and Penn Medicine. And patients and clinicians feel like a lot of that joy in medicine is coming back for the first time ever since the implementation of the electronic medical record.
The other thing that may be significant here is the potential that you say this has to accelerate clinical research. How soon could we be seeing that?
I think what's really exciting about many of the researchers working inside of these academic medical institutions is that they're studying some of the hardest cases. And just as we're seeing AI accelerate our ability to produce software, these capabilities are also beginning to accelerate these clinician researchers to ask and answer the right questions. There are many complex diseases like long COVID and fibromyalgia and chronic fatigue syndrome, where we just don't know the answers to these questions. And we're already seeing these technologies accelerate our understanding of what exactly is going on with these conditions and opening up entirely new ways of treating these conditions. I think in the next 18 months, we're going to start to see new therapeutics and new ways of treating these complex diseases arrive and touch patients. And I think it's only going to get faster and faster from there on out.
18 months. Okay, Nikhil, you have seen the backlash against some iterations of AI, and you know people are growing more and more skeptical. Do you believe this application into the healthcare realm will really be redeeming for artificial intelligence and really show people what it can do? Having said that, it has to live up to the expectation.
I think you're right. There's a lot of responsibility that comes with the opportunity ahead. But I think our healthcare system is at a breaking point. We've got 10,000 seniors aging into Medicare every single day. We spend $4 trillion as a country on healthcare. About 1/4 of that is on administrative waste. And yet you think about the fraction of the population that actually has access to the very best medicine in the world, it's far and few between. And so I think this capability has a pretty incredible opportunity, which is how do we take the very best medicine in the entire world and scale it to the entirety of the country in a way that's affordable and accessible to everybody? And I think that's the call to action that makes us want to show up to work every single day here at Ambience.
And when we talk about timelines again, I know I was hearing you in about 18 months. I mean, how rapidly do you believe patients will see this with their doctors? Because it isn't everywhere right now.
You know, we're already deployed across 80%, for instance, of all of the clinicians at Cleveland Clinic. And so if you get care at Cleveland Clinic today, chances are your doctor is using Ambience and talking to you about Ambience every single day. And we're seeing that trend continue at a pretty exciting rate. And so I don't think it's long before every clinician is using a technology like this.
Okay, Nikhil Buduma, thanks so much for bringing us some of those insights about how AI can be applied to our healthcare. Appreciate it.